Malaria is the #1 fatal endemic disease in the West Nile region, with Arua district, Ajia, Voro sub-counties in particular. Malaria contributes to 62% of outpatient care for children under 5 and pregnant women in health facilities, 35% of inpatient admissions, and 4% of deaths in children under 5 and pregnant women. 35% of pregnant women were inflicted with FANSIDA during antenatal care during their pregnancies. Putting this in mind, the Ministry of Health is rolling out indoor residual spraying in 13 districts in West Nile and Lango sub-regions, which include Madi Okolo, Koboko, Terego, Maracha, Ajumani, Arua, Yumbe, Moyo, and Obonji. In the Lango sub-region, districts that will be covered under this exercise include Dokolo, Kalachi, Amolata, and Kaberamaido.
Now, these districts were selected based on their high burden of the disease, and in keeping with the principle of contagious expansion to ensure maximum benefit. So we'll be doing a total of 13 districts. The ones I have just read up there. So they add up to 13.
Speaking at the flagging off ceremony held at the Ministry of Health headquarters in Kampala, Dr. Henry Mwiresa, the Director General of Health Services, said the exercise will cost up to $8.5 million and implemented through the existing institutional leadership structures.
And we are going to be working with the leadership in the districts so that they are all part and parcel of this exercise. The local leadership, the technical leadership, and all our staff in the districts will be involved right from the district to the sub-county level, including the district task forces and even sub-county task forces. We have coordination committee meetings at those levels.
The effectiveness of the indoor residual malaria control intervention arises from the fact that many important malaria vectors feed indoors and rest indoors, where they rest on the walls, ceilings, and other interior surfaces before or after feeding on humans. The districts of Madi Okolo, Maracha, Nebi, Obonji, Pakwach, Terego, Yumbe, and Zombo are among those reporting an upsurge of malaria cases, with the majority of the cases being reported among children below 5 years. In the malaria strategic plan, the government hopes to reach out to 50 high-burden districts at least by 2025.